She thought the Bernese Mountain Dog was being overprotective of the toddler around her. He wasn't protecting the toddler from her. He was protecting the toddler from what was about to happen to her. The distinction took a cardiologist to explain. Jenna Ostrowski was 36, a kindergarten teacher, and had not had a cardiac event in her life. She had no history, no family pattern she knew of, no symptoms she had been tracking. She was healthy in the casual, unexamined way of someone who has not yet had a reason to examine it closely. Their Bernese Mountain Dog, 4-year-old Bruno, was a large, gentle, deliberate dog who had been in the household since before 2-year-old Mira was born. He had accepted Mira with the benevolent authority of a dog who has decided that everything in his household is his charge. He was protective of her in the normal Bernese way, present, watchful, slow to alarm. On a Tuesday morning, Bruno changed. He began following Jenna. Not Mira, Jenna. He positioned himself between Jenna and Mira, body angled toward Jenna, face toward Jenna's face. He did this in the kitchen. He did this in the living room. He did this when Jenna went upstairs and came back down. Her husband, Henrik, who worked from home, noticed by late morning. He said, "Bruno keeps putting himself between you and Mira." "I know," Jenna said. "He's being strange." She was not alarmed. She was mildly puzzled and mildly irritated in the way of a person who does not have room in their Tuesday morning for a dog to have a behavioral episode. At 11:40 a.m., Jenna sat down at the kitchen table with a cup of coffee and felt her heart do something it had never done before. Not pain. Not the dramatic chest clutching of the movies. Something more subtle and more frightening. A flutter. A pause. A sensation of her heart searching for its rhythm and not immediately finding it. Her vision narrowed slightly at the edges. She put her hand on the table. Bruno was at her chair before she finished sitting down. Henrik came into the kitchen. He looked at his wife's face. He looked at Bruno pressed against her chair. He picked up Mira. He called 911. Subscribe now, because the cardiac monitor the paramedics attached in the kitchen showed an arrhythmia that the emergency cardiologist on call described as requiring immediate management. And what that cardiologist said about Bruno's behavior that morning is what Jenna has been thinking about since she came home from the hospital. Jenna was diagnosed with paroxysmal supraventricular tachycardia, a type of arrhythmia characterized by episodes of abnormally fast heart rate that begin and end suddenly. The episode had been building. The electrical pathway irregularity that caused it had been present before the Tuesday event, present in ways that altered her heart rate variability and her physiological chemistry in the early morning hours before the acute episode. Dr. Carla Nascimento, cardiology, told her SVT has a pre-episode window during which the autonomic nervous system is in a state of dysregulation. This produces detectable changes in blood chemistry, skin conductance, breath chemistry, and scent profile. Dogs have been documented alerting to cardiac arrhythmia onset in their owners in the period before the acute episode. She looked at Jenna's file. What your husband described, the dog positioning between you and your daughter repeatedly from mid-morning, is consistent with a dog that registered physiological changes in you and positioned itself to intercept the outcome. He put himself between you and the child because he anticipated you would need support and the child would need protection from the fall or from being dropped. She paused. He was protecting you both. If you stay for stories about what animals sense before we do, you're in the right place. Subscribe so you don't miss the next one. Jenna has a treatment plan and a cardiac monitor. The SVT is manageable and managed. She carries an awareness of her own rhythm now that she did not carry before that Tuesday. Bruno still follows her on some mornings. Most mornings he doesn't. Most mornings he goes to his bed by the window and sleeps in the full committed way of a large dog who has decided the morning is clear. But on some mornings he comes to her, and on those mornings Henrik takes Mira and Jenna sits down. They have not needed to call 911 again. But they have used the sitting down protocol 3 times. Each time the feeling passed. Each time Jenna was seated when it did. Has your dog ever positioned themselves between you and your child in a way you didn't understand at the time? Tell us in the comments. These stories deserve to be heard. Mira calls Bruno her big dog with the proprietary certainty of a 2-year-old who believes she owns him. He lets her believe this. He follows her to her play corner and lies down at the edge of it and watches. But on some mornings, he is in a different position, doing a different job, and Mira is with Henrik. And that is fine too. Every guardian deserves to be recognized, even the ones who never asked for anything in return. If stories like this matter to you, subscribe so you never miss the next one. Jenna told Mira once, in the simplified language of early childhood, "Bruno helps take care of Mama." Mira looked at Bruno. She looked at Jenna. She went back to her blocks with the efficient pragmatism of a 2-year-old who has accepted this as adequate information. Bruno exhaled and settled his chin on his front paws. His job is exactly what he decided it was. No one assigned it to him. No one taught him the protocol. He built it himself over 4 years of mornings in a house where he was paying attention, and he used it on a Tuesday when it was needed. Next, a husky who began sleeping outside the baby's room with her back against the door every night for 2 weeks. And why the pediatric audiologist's findings changed what the family understood about those 2 weeks.